How can you tell if the horse's teeth were done well? Really common question. A lot of people want to know, Doc, how do I know this guy's doing a good job? Well, you don't. It's not like the feet where you can actually see. And oftentimes you can see the feet, but you may not know what a good foot looks like. And certainly you don't know what it looks like inside a horse's mouth. And when you're shown in there to look at these things, sometimes it just doesn't make any sense to you. The one thing you need to keep in mind is it's not how sharp the teeth are, it's the threshold of pain. And the horse is going to tell you if the job was done right. So if the threshold is high, sometimes you don't even need that the horse know that the horse's teeth need doing, because the horse is just kind of hanging out and not giving you any indications. Yet inside, the teeth are extremely sharp and the horse is having difficulty moving food around and it's not being very efficient there. Or you have the opposite, the horse that's very, very sensitive and will just cry out with pain for the slightest little pimple. And that's the horse that you need to get in there and get every point taken care of. And if you don't, the horse is going to show you some indication. So you can get a guy floating teeth that gets 95% of the teeth done, and as long as that one little point is still there, the horse is going to give that reaction where you put pressure on the bit and it reacts. So thoroughness is the most important thing, and the horse is going to tell you. The horse should feel more comfortable, more relaxed, more willing to flex at the pole. When you turn the horse left and right, the horse is going to be more willing to respond to your bit pressure after the teeth are done. Some horses that have chewing problems will be resolved once the teeth are floated correctly. Removal of pain or the cause of pain is the number one goal of floating teeth. That's my opinion. It differs from everybody else out there, but that's okay. They can say what they want. For me, this has been the number one issue in a horse. The other thing to remember, sometimes some of these issues that you see on the bit are created outside the mouth. They could be in the nuchal bursa, which is up near the pole. They could be in the cervical vertebrae. There could be lesions that could be adjusted by a chiropractor, or maybe it's more severe and they have to be injected. Some of these horses just slip. I saw a horse the other day who got down and rolled and just was having a good time, got up and started to tear around the paddock, and in a blink of an eye slipped, and his whole body just shook as he tried to regain his balance, and it was over. And you're not watching your horse 24/7. And these things happen all the time, and as they slip and fall, they can injure their neck. And over time, it could be months later, you start to see these injuries show up, and it's not related to the teeth at all. So it makes it a little bit more complex, but you have to rule out the teeth first and make sure that the teeth are done correctly. And 90% of the time, it is in the mouth, and the horse will respond to a good float job, and that's how you tell if the horse's teeth are done correctly or not. Hope that helps.